Joseph Campbell said that myths are public dreams. I guess it's time to wake up then. Let's start with Mythbusters. We have a question, and this is coming from Oroku, who lives in Sefirioso. And his question is, does wearing tight underwear kill sperm?
Time and again, this question keeps coming up. It's a guy problem. It's a very common guy problem. Okay?
They're concerned about their sperms.
True. Let me help you out with that. Yes, if you wear tight boxers all the time, it will affect sperm production. Your testes are actually situated outside your body because they need a temperature that's lower than your core body temperature to function. It's not that they need a very cold environment. You will notice that whenever you get into cold weather, your scrotum actually shrinks and it pulls itself towards your body. So what happens is that the outside temperature in that situation is a little too cold for sperm production and for function of the testes. As a result, it pulls itself to a much more warmer environment. In a hot weather, they actually come back down. So the thing is, there's no particular temperature you would say. It just has to be slightly lower than your normal core body temperature for you to be able to produce enough sperm. So if you get up and you start wearing tight boxers, what you're doing is that even in hot weather, you're pulling them to your body. You're trying to force your testes to actually absorb heat and take your body core temperature as its own. And this is just likely to affect your sperm production. So no, it doesn't kill sperms, but it reduces sperm production. So men are usually advised to wear boxers or pants that actually allow your scrotum and your testes to breathe. And the area around them is cool enough for you to be able to attain utmost sperm production.
Stay strong, live long. I'm sure you've heard this slogan a few times. On this segment, we give you advice on staying strong for a longer life. Okay, so we hit the streets with our cameras.
My name is Musa Sule. I have a friend, if he sleeps sometimes, he talk alone. I don't understand the reason why, so I want to know. Yeah, if he sleep, he used to talk. And let I wake him up before he will realize that he's talking. But if I tell him, he don't believe it. So I want to know the sickness. What causes that?
Well, Musa, what your friend is encountering is something we call somniloquy. That's just talking when you're sleeping. There are many different causes of it. Some of them are things that you can actually just adjust, and some of them are things that you might have to work at by seeing your psychologist. It can range from just simple whispering in your sleep to actually talking. And in some cases, you can actually say a lot of offensive things. In some cases, too, you find out that people actually enact what they're going through. So it's not just the talking, but hey, he's dodging a blow, he's telling someone to get down and stuff.
It's a whole movie.
He can actually act the whole thing out. You'll be surprised. Some of the things that actually cause this, well, are what we term sleep terrors or nightmares. Obviously, if you're having a nightmare, you just might end up saying certain things you shouldn't say. It's like, oh, leave me alone, or something like that. We also have what we term REM, sleep behavior disorder. REM simply means rapid eye motion sleep. It's a stage in your sleep cycle. When you get to that stage in your sleep, then you start talking. Other things that can actually cause this are even emotional stress. If you also have fever, certain fevers can actually affect your brain, and then, well, you don't just talk unusual when you're awake, you also talk unusual when you're sleeping. You can also have this when maybe you have a particular mental health condition, and if you're taking certain substances you shouldn't be taking. So substance abuse in itself is a reason to have these kind of situations and for you to talk in your sleep. So the good thing about it is that, well, in children, it can actually just go away. As the child grows up, the child feels better and the thing just vanishes. In adults, however, you might need psychotherapy or some kind of treatment. Certain things you can actually do to avoid sleep talking is watch the medications you're taking. Like I said, some of these medications can actually induce it. I'm not saying stop taking the medications. However, make sure you take them at an interval that's a little bit more satisfactory. Be way before you go to bed. Be careful of some of the stimulants that you ingest, like your coffee, for instance. If you take these things just before you sleep, it actually increases your chances of talking in your sleep. Also, if you're someone who likes to exercise, I would advise that, well, you exercise way before you go sleep. Don't just exercise and go into sleep. These are some of the things you can actually do to avoid sleep talking.
The following segment contains material of an adult nature. Viewer discretion is advised.
Good sexual health also means better physical health. It's sex talk now.
Ellie lives in Zabzongo, and this is his concern. What are the side effects of using sexual enhancement drugs like Viagra and the likes?
I think Viagra has become a household name lately. Viagra can be helpful if you need it, but it can also be very dangerous if you're not supposed to be taking it.
Okay.
Because incidentally, Viagra was first used in people to treat what we call pulmonary hypertension. I'm sure you know what hypertension is, high blood pressure. Now, initially, some people who had chronic lung disease, they've had a lung disease for a very long time, Viagra was initially used to treat that. They found out, though, that those who had erectile dysfunction or problems with erection benefited from it. So they were wondering, is this drug affecting it in a way? And they actually found out that, yes, it was. It was really helping. Because the mechanism by which it works, it makes the blood vessel open up. And like I told you, the pressure in the lungs of somebody with that condition, pulmonary hypertension, is high. So it opens up the vessel to bring down the pressure. And in that same way, it also opens the vessel in every other part of your body, including the penis. And you know how you get an erection is by blood flows through the penis. So if the vessel is opened and very wide, you can imagine it can accommodate more blood, and then you can get a better erection. So people who have even had damage to the penis or to the vessels from diabetes do benefit from Viagra. However, Viagra is a prescription drug. It should be given to you by a doctor. And the reason I'm saying this is because Viagra has a lot of side effects. Now, because it causes your vessels to open up, you may have effects that will just end in about 12 to 24 hours, where you have flushing because more blood comes to your cheeks. You may also have problems with your stomach. It may cause indigestion, you may have dyspepsia, and you may have pain at your back, you may have muscle pain, fatigue, a little bit of that. But all that will resolve. However, it can affect your vision. Some people after taking Viagra for a long time tell you that everything they see is blue because Viagra has a way of doing that to your vision. So you can choose between getting a good erection and having a good vision. I don't know what you would choose, but some people will still go on and take it.
You'd be surprised. Someone said, I'll live with my blue vision.
You know? And if you have a problem with your kidney, if you have a problem with your liver, you should not be taking Viagra. If already you have very low blood pressure, for example, some people have heart failure. When you take Viagra, you will dip your heart failure deeper into the grave because already it can't maintain the pressure. And now you're opening the vessel, so the pressure that is left all sink down and it just sweeps away. So before you take Viagra, see your urologist. That's the doctor that takes care of men. Let him check you out, make sure you're fine, and then they'll prescribe it. Apart from Viagra, there are others as well. So if one doesn't work for you, you can be given others. But most of them have a similar mechanism of action. So
this goes to just about any kind of sexual enhancement treatment. There are lots of brews and herbs and alcoholic drinks that people take, various combinations. Most of these things actually have side effects, really, that we don't know about.
Yeah.
So advisedly, try and stay away from these things, especially when you don't need them. There are lots of young guys right now who actually do not need sexual enhancement drugs. You don't need performance enhancement if you don't need it. So try and stay away from them. Most of these drugs will always tell you what the side effects are. The ones you should even fear the most are the ones whose side effects you haven't found out yet.
Sexual enhancement drugs can work, but it's important to see a doctor for the best prescription for your situation.
It's time for a commercial break.